Welcome to the Homegrown Heart Podcast every Friday at 7 a.m. Mountain Standard Time with your host, Dr. Amanda Ryan, DO, MBA, interventional cardiologist, and an expert in her field. This week's topic, the realities of a cardiovascular ASC, and we're going to meet some of the staff members behind the scenes. Right now, help me welcome our host, Dr. Amanda Ryan.
Good morning, Carlsbad, New Mexico, and world. This is your friendly interventional cardiologist, Amanda Ryan, and today's podcast is going to be focused on the difference in a quote-unquote maybe old-school physician office in a rural cardiovascular practice that includes a surgical center in modern-day healthcare times in America, which I think you're going to see a vast difference. Part of that, I'm going to interview a lot of my staff today. So I'm going to tell you again, Tammy Wacker. Tammy is the head of our foundation, Partners in Heart Health. She also leads marketing communications, and again, recently has stepped in to help us with our revenue cycle management position. Crystal Bly, again, is a long-term employee of ours from Florida who rejoined the team out here. And she's a director of patient care and development, and I'll let her tell you about what her job really focuses on. Johnny Clark, her tasks include running our chronic care management program, as well as helping with prior authorizations and really helping with buckets, quote unquote. How could I forget buckets? So they're going to tell a little bit about what's involved in that. Nikki Cooper is, again, my best friend, who also has a lot of experience running a business, doing accounts payable, working in medical records at a hospital that I used to work at in Florida for years, and running a busy household. So she joined us and got to be HR as well as the director of finance and accounting. And she's going to share a little bit about her daily task, what's involved. And then last but not least, my husband, Amari Williams, who left his busy job in the construction contracting sector to really help focus on raising our girls, as well as doing prior authorizations and billing for our practice. So I think the point of this is to really give you a grasp of what is honestly required and involved. So, all right, good morning, team. Wave if you can hear me. Good morning, everybody. Good, all right, good. So we're gonna kind of go around a little bit. I wanna know what your day is like. So, Johnny, why don't we start with you? On a typical day, how do we start Mondays with our practice? That's maybe a good thing to kind of, so think the audience has no idea what we do. And again, we've got about 30 to 45 minutes. So while it might take 3 days to explain everything to them, let's keep in mind we're trying to tell them in, a couple minutes or less. What do we got going on?
All right. So usually on a Monday morning, we start with our morning meeting, our meeting priorities on Monday morning meeting. Kind of get delegated what's going on for the week, just a jump start. And then from there, everyone is into their daily tasks. Monday for me usually consists of chronic care management. I'm calling my patients chronic care management. Should I be explaining it?
Yeah. Mm-hmm.
Okay. So chronic care management is the program that I am in charge of. The purpose of our program is to improve the quality of life for our patients. By managing symptoms, medications, kind of preventing any complications that they may have,
and Johnny,
encourage.
Which of our vulnerable patients do we really focus on for that chronic care management program? Who are we trying to enroll?
So we're trying to enroll patients with chronic conditions such as congestive heart failure, hypertension, deep vein thrombosis, anything like that. Chronic conditions that most of our patients do suffer from. So we have a large variety of patients that qualify for our program with chronic conditions.
Tammy, on CCM, what is some of the data we've looked at as far as we did some surveys from last year and, we went to some meetings about chronic care. What does chronic care bring to a practice, Tammy?
Well, For us, this kind of goes into the realm of the different types of services that can be delivered in the future, like telemedicine, remote patient monitoring, those type of things. When you're looking at someone who is not only dealing with chronic care issues, but they're in a rural setting and maybe they don't have, they're low income and they don't have transportation services. This kind of opens it up for us to be able to explore different technologies and to deliver those services and at still a high quality, but yet expand them for that person and make it easier for them to receive it.
Definitely. Okay, Jonique, go ahead. How about focusing a little bit on the feedback that we have gotten about our program?
Patients, they actually love chronic care management. They look forward to their weekly calls. I think it gives them a sense of security that if they have any extra questions or if they need to get in touch with the office, they have that extra resource. So it
yeah,
just instills more confidence in their healthcare.
Definitely. And while you mentioned that, why don't we just put that out there? Issues with the office, and I'm sure you hear about it often. So Crystal, why don't you say a little bit about, what feedback do you get on our, $60,000 phone system that doesn't work right? Yeah.
Yes, that's an everyday issue where they have to leave a message. In this day and time, they don't like to leave a message. They feel like there is an urgency for what they need and they want to speak to someone right away. With going to the extensions has been a huge help. They call directly 2717 to my number. I'm sitting right here.
And where are you located, Crystal?
I'm in Florida.
Okay, Florida. And Jonique,
So
where are you located?
Florida.
Yes. Tammy?
Illinois.
Yes. Nikki, where are you located?
Florida.
Okay. And Amari, currently?
Florida as well.
All right, great. So yeah, so I bet people in Carlsbad have no idea that we have such a robust group of people working behind the scenes to help meet their care either. I think they also don't always understand the complexities of what's really going on. This part of the idea for this session really came from Danny and me talking last week. He's a patient of ours and he's familiar with it, but he really had no idea on the complexities. And we brought up in particular the nurse practitioners and how a lot of the patients, they respect our nurse practitioners in New Mexico. They have full practice rights. They're well trained by myself and their extensive backgrounds, but patients want to see me. They want to see Dr. Ryan. And that, is somewhat of a challenge. What is our patient, and whoever wants to just tell me who wants to answer this, but what is our patient volume kind of started at? What did we leave the hospital with? And when we left that practice of about 6 years, and where are we at now? Anyone?
I believe you left with about 2,000 patients, and I believe
Yes.
we're up close to 10,000.
Yes. And that's where I'm going to talk. I was doing some research for this week's session as well. The average cardiovascular practice in a suburban area, just period, has about 1,700 patients that are active at any given time. So we left with about that, and there wasn't really a cardiologist coming in behind me for that practice. So really anticipating that most of those patients would follow us at the same time. It's been 2 years. So it was March of 2022 to now, and we're at 10,000 patients. So when we think about how are we going to really manage those patients appropriately, it required thinking outside the box a lot. Really get, I think in medicine, maybe billing and medical records are done remotely, sometimes for many years. But this idea that a lot of these services that you guys are providing could be done remotely has kind of been a developing thing over the last, 5 to 10 years. I think it's become even more and more. And I think COVID really pushed us too. I'll be honest, I was a little old school. I'm not that old, right, babe? But I'm a little old school in the sense of I'm like, no, people have to be in the office. You have to see what, not because I feel like that someone's not working. It's just kind of a non-traditional approach to it. But I have realized that honestly, remote workers can be more effective. They can be more productive. Amari, why don't you tell me a little bit, what do you have to do to be productive? What is the main thing that you do in a day for the practice? And how do you get yourself into that productive mode?
It's kind of, I don't know. My day is kind of strange because I'm working at different times of the day. Like usually first thing in the morning, I'm getting my daughters ready for school, so I can't really just get straight to work.
Right.
So usually I start off with getting them ready out the door. When I get back, I'm focused on trying to get authorizations that I've received the day before of procedures that have been put on the schedule. So that's usually how I start.
And how much time might it take? Let's say Mr. Jones, who's just random here, we don't really have Mr. Jones with a leg, has a blockage in his legs. Because again, we're a full cardiovascular practice, right? We're not just treating hearts. We're treating arteries in the legs, veins in the legs, aneurysms in people's abdomen, carotid artery blockages. I mean, we're just a full cardiovascular practice. So we have a blockage in Mr. Jones' leg, and we want to do one of our fancy new procedures in our surgical center, where we're going to kind of, as I tell patients, jackhammer through that plaque in their leg and balloon it. We don't stent legs unless we have to. So how long does it take to get maybe an insurance company to approve that procedure?
Well, it varies. As you know, some insurances, they're not going to require an authorization at all. So
Still requires you looking it up, figuring it out, putting it in a portal, or which can be online, or you actually call the insurance. Is that kind of accurate?
yes. Usually if I know it doesn't require authorization, I'll call. That's the quickest way to, get it approved. But it can take up to have 30 days from the time you submit it until the time they have to give you a decision. They'll tell you it can take up to 30 days.
Crystal, why don't you tell me how?
So it's mainly about just getting it in as fast as you can.
Yeah, and Crystal, when you're waiting that 30 days, how do the patients respond to what's going on with their procedure sometimes?
I get quite a few phone calls, messages in our portal, which I love when patients use the portal. I wish more would use it.
Yes, definitely. Going away from live operators always answering the phone is truly the last thing I wanted to do. I wanted to have somebody well-trained answering our phone. And we started with 3 people in the front. We've had 4, we've had 5. The truth is we could have 20. There's times we couldn't handle every direct phone call. That's just realistic, right? So sometimes it's just, we have to utilize our other resources. I think Johnny, Crystal, rest of the team makes a real quick effort to answer portal messages. And we try to make sure that we say, we appreciate you reaching out through the portal. And, we've talked to Dr. Ryan, and this is what this is kind of what we came up with. So I think letting people realize that we are definitely there to be supportive and answer their questions as quickly as possible. And we understand the system's frustrating, but sometimes, Amari can tell you, and Janique, I'm constantly like, do we get that off yet? Do we get that off on that patient yet? And they're like, nope, still a review. I've called 4 times and I've put it in the portal and I've checked the status. And still not approved. They wanted clinicals. Sometimes they want what's called a peer-to-peer. Janique, why don't you tell us, what is a peer-to-peer evaluation?
A peer-to-peer evaluation is when we have to call the insurance company, let them speak to the doctor one-on-one, or send in a peer-to-peer letter, so that we can get the procedure approved for them to have.
And have we ever done a peer-to-peer that they denied it after we talked to them?
I haven't experienced that. I actually did my first peer-to-peer letter, and it went through really quick. It was like the next day they approved it, and it was just off of verbiage.
Yeah, I've never been on a peer-to-peer that didn't, and I would say our overall denial rate is maybe 2%, and then we have to deal with it, if that. So, but to think that, we're employing, 3 full-time people
probably, who a lot of their task is just to get approval for test, that 98% of them get approved without any further, is that really good staff? Is that good utilization? I mean, that's just reality. Is there something else we could have our staff doing that were more meaningful for our patients? And I think you can tell by the leading way I'm asking that question that I obviously think so, that there are other things I could have us doing. There's this idea sometimes that hospitals or physicians are just randomly ordering tests for people. Nobody goes through 17 years of training to not have a methodical, guideline-based way that we order tests. Now, there are a couple percentage of providers and systems that probably are abusing the situation and over ordering. Probably true, like in any industry, but the overwhelming majority of people that are in healthcare, I truly believe, are in it for the right reasons, and we're ordering what's appropriate for patients. So then when we have to wait months at times to get this stuff approved, it just really slows down the flow of patient care. So, that's kind of reality. So with the nurse practitioner thing too, I just wanted to say, I had kind of mentioned this to Danny last week. I don't know that people realize that even if you're seen by the nurse practitioner, we do review those cases. Before the patients come in, we look over our list and we really have open discussion about any patients that I think something relevant needs to be communicated. Johnique's chronic care notes will be in the computer, and we'll kind of review those and make sure that if it's a patient that's in that program, we're all aware of what's going on with them. If they have an authorization that's pending, if they have Tammy, if they've applied for something from a grant from our foundation, right? We have all of those things. So we kind of try to tie in that we're all on the same page. Now, are we perfect with that? No, we're not. We don't always know when you walk in the door. All 35 of our employees don't know every single thing that's going on with you in your care. And I'm sorry, but that would be unrealistic to think we did. We are utilizing every tool that we can think of. We are as organized as long as Nikki signs off that we can afford to use every tool. If I ask Nikki to delineate all the different programs we have to improve communication and our interoperability between systems, she'd tell you, Nikki, how many do we have? You don't have to name them, but how many programs do we have that are designed to help our communication with one another and the patient?
A lot. I don't know the exact number, but it's a lot.
It's 10 or 12. Our IT guys are telling us the next one that we need. Or Tammy's putting before us another proposal.
Yes.
Something that would be really great for us.
We're just trying to close loops.
Yes. What kind of communication do we practice, team? On that note, Nikki, what are we trying to do?
Close the loops.
Closed loop communication. We really are doing our best for you and patients, potential patients, former patients, disgruntled patients. I want you all to know that we really are doing the very best that we can to stretch ourselves. And some people say, even staff that have came to work for us have said, why don't you just close it to new patients? I just struggle to do that in a rural area that should have 6 to 8 interventional cardiologists and has 1 or 2 at any given time. So it sounds like, there are some very good specialists I think I've mentioned in our area. They often take 6 to 9 months to get an appointment with. They see about 20 to 25 people a day. You don't have to wait 2 hours in their office, and you probably won't see a nurse practitioner, but you may wait 9 months for your appointment. And I'm not saying they're wrong and I'm right, or I'm right and they're wrong. I'm just saying that there's more than one way, quote unquote, to skin a cat. Is that a PETA appropriate thing to say? And I know you have kittens. Sorry, I'm just saying there's more than one way to do things, okay? And sometimes we're doing the best we can. We're trying to figure it out. Johnique mentioned that we start Monday morning with priorities. I don't know, Nikki, you were with us in the beginning. Where did priorities come from? Why did we start doing that? What happened in March of 2022 to get this going? How has the vision changed somewhat? Those, where we started, where we are.
We added a lot to our team, so we wanted to make sure everybody was on the same page and communicating well and closing loops.
Yes. So we started, a practice that was a little unorganized. We knew that we wanted to build a surgical center, and creating our practice in an independent fashion was going to be part of that. That was a several-year culmination. It did not happen overnight. It didn't always happen as a smooth transition. walking away from corporate America, as I've stated I did, and really developing an independent practice with a lot of people that I had worked with over the years in different capacities, but bringing most of those 2,000 patients with us for a full practice from day one. We didn't have an EMR yet, an electronic medical record. We didn't start for a couple months until after we were going. We weren't on any insurance plans. We didn't have, it just kind of happened faster for reasons I'm not going to discuss today than we really anticipated. And as part of that, we were doing our best to build solid infrastructure. We spent a whole week, a training week. This was Karen, mom's first experience with the practice. She took a break from her corporate America job. That week, we had everybody focused on an entire week of training, where we really just we probably spent 10 hours a day going over so many different aspects of running an independent cardiovascular practice. We had people that came from different industries. Again, healthcare was not the background of some of our people. Some of our people were experienced healthcare. So there was just a lot of different people, personalities, and knowledge base we were trying to merge. So as part of that, we had Karen come and answer the phone, and she was like, how hard can it be to answer a phone at a doctor's office? She learned real fast that it can be quite a challenge. And so that it's really been, I think, the hallmark of what we've developed over these last several years has really been about stopping and pivoting. Maybe I was kind of naive in some ways, and I hate to ever use that word. Some people have criticized the journey and said, that we were naive as far as, corporate America healthcare versus independent healthcare. I don't think I was naive to that, but there are some things I was a little bit naive about. I thought you do a startup, you have committed people, you add solid people as you go, but everyone that starts the journey, quote unquote, ends the journey with you. And that's not the way it goes. Personal life things happen to people's lives. Things that a startup is very difficult. That's just the truth. It's very hard. A startup that then has 5 times the number of patients that the normal cardiovascular practice does, while building a surgical center, while trying to get national accreditation, while trying to get on every insurance plan. And by the way, just skating by financially every month while we do all of that. It's a lot of stress. And it's a lot of stress for a lot of people. So there's been people hop on and off the team. And I will say one thing that I'm proud of as a physician, and especially when a mentor of young women, I feel like anyone that's been on the team for any length of time has definitely left this team with more knowledge, more skills, and more capabilities than they started it with. And that's, sometimes I've had to adjust my heart, my goals from everyone that starts is there at the end, to realizing that life happens and that that's not always how it's meant to work. You really do have to give it to God sometimes, and the plan is the plan. The mission goes on, but sometimes the mission changes a little bit. So I'm proud that everyone who has been on this journey is continuing to acquire skills that are really helpful in delivering good rural healthcare, whether it's with our corporation or another, or a small business or a large corporation, any of the above. I'm just happy to have participated in their growth. So sometimes you have to adjust your goals based on reality. Tammy, why don't you say a little bit about your background and how you kind of got with AHV&M and Partners in Heart Health?
So my background extensively is with nonprofits and in healthcare, particularly long-term healthcare. My education is in gerontology and human services. But I worked with Dr. Ryan's mother and long-term care. And then when she had come down to be a part of the practice, they had called me. And when Dr. Ryan was talking about opening and starting a nonprofit foundation, then we had some conversations about it, and I think it fits in perfect. I think the thing I love about it so much with Partners in Heart Health, your foundation is that You talk about us being a team, and we are a team, but a big member of our team is each patient. And that's what Partners in Heart Health actually really promotes, is the patient's responsibility in our team. And, whether that is from registering correctly, using the portal, finding out those things that can make their journey in their healthcare simpler, as well as, get more out of it. And, I know, being the director of marketing and outreach and communications, I don't have to do a lot of marketing in this rural setting. Like you said, you went from 2,000 to 10,000.
Yeah, we could roll. Nikki asked sometimes we roll back the marketing. You know what I mean? We roll
Exactly.
pay less and roll it back a little. Yeah.
A lot of it is that outreach, like calling those patients who are upset, explaining to them. We had an example, we had one recently that they just didn't understand. Utilizing the portal, you have access to see what's in your health chart. They didn't understand that. So it's having that communication with them. And once we had that communication, she kind of understood what her part as the team was. And that was good to see. So this has been a wonderful experience.
That was because obesity was one of the diagnoses, and there's a little bit of a stock phrase that goes in our electronic medical record. If you're technically obese, and it says you should limit your foods, she kind of felt attacked that we were saying she wasn't trying those things. And I think once we were able to explain to her, no, it's just kind of a stock phrase. You may be doing these things, but this is just a stock phrase that comes with your, I think that was important.
Exactly. So it's just that communication. It's closing that loop. Like Nikki said, it's having everyone understand everything that's going on and understanding the importance part that patient plays in this. So
definitely.
Yeah, I love it.
I think, again, Jonique, with your CCM program, that's, again, where you're really able to, patient accountability was the big our podcast with Bob Kolker last week, which is just great as far as, and I think you really try to focus with the patients that they have to be somewhat engaged. You're getting some of our most vulnerable population, I feel like. How do you try to really engage them on your weekly calls?
I just try to engage them by being understanding. I try not to come off as judgmental at all.
Yes.
So just more so being understanding and compassionate to their current situation or whatever they're going through, but still reinforcing it with goals.
Yeah, if they struggle to tell you what meds they're on or what they're taking, you take your time, right? And they can go get their list, or even you've had to call their pharmacies, or you talk to their family members as well, right? It's not just for patients. You really engage with their families also.
Correct.
Yeah, I think all that thing. So Crystal, how about your role again in that liaison? When, as a cardiovascular practice, real advanced, we tend to send to CT surgeons and vascular doctors and electrophysiologists. What are you doing in that role?
I'm sorry, you broke up there, Dr. Ryan.
Oh, saying that, what are you doing to liaison with these other physicians that we refer to for CT surgeons, vascular surgeons, electrophysiologists?
So I work really closely with those specialists to ensure that the patients have what they need to be able to get in to see the doctor. Their referral, their medical records, their cardiac cath CD, their angiogram CD, because unfortunately, if they don't have that stuff with them, they're driving all the way to Lubbock. They're going to be refused and have to come all the way back home to make sure those records are there. So that's part of my job, is to assure that all that's there. I have close contact with all your specialists, their nurses, their front desk, and their cell phone numbers, where I'm able to get what they need right then and there, including what our providers need.
And how, on a daily basis, how many of your 10-hour day, how many hours are you spending on that, do you think?
Probably 6 to 7.
Yeah. I think people just don't. I think they think we put a referral in, it happens, and that's the end of the story. And that's not how it works. So
no,
definitely.
It's not, because, everything is electronic. Not everything always makes it. In this day and time, there's so many fax numbers it goes to that it may go to this one fax number that might be Sally's desk, but it needs to go to Susan's desk. Well, Sally shreds it because it's not hers.
Jennifer's or Amari's. Yeah, it's 5 desks. And Amari's shaking his head because on the prior auth world, how often do they say they didn't get what we uploaded or sent? And then Desiree, as Amari's supervisor, who, by the way, is quick to be like, oh, you didn't get this, you didn't send it, like I've sent it 3 times. I've uploaded it. Sometimes the portal uploads it as all blank. You're like, I don't know what happened to it. I mean, I just think the follow-up is insane. And then Nikki, why don't we close out a little of this discussion with again, tell me a little bit about what you're doing, which we recently had a little restructuring and showed all the different roles. And when I had your 2-page list of things you do, I was wondering how you've managed to get it done. Spend a lot of time in your corner, I know.
Yes. Just trying to prioritize and organize, really trying to figure out, what needs to be done first. And
what's an average day for you? I know it's hard to say. What are you working on?
I do all the accounting and HR, as well as help with the partners in heart health. So, I jump around a lot from task to task for sure.
And sometimes it does leave you feeling a little bit like you couldn't totally, again, that same mom guilt that also rolls in. If I can't do anything totally well, I'm doing the best I can to onboard a staff member and to do this, to do that, but we're never getting like the full, not able to close every single loop, so you're trying to make sure we have money in the account to pay all these suppliers, that there was a purchase order that matched up with the appropriate invoice. Now that's been why don't you say a little bit about our Philips process with that, who we bought a lot of our equipment from. Philips buys out smaller companies oftentimes, right? And then what happens in the invoicing world for that?
Well, in the invoicing world, it came from the smaller company. So we had to try to match it with the the PO that we made. It was it was a mess. I think we've been working on it for about a month or so, trying to figure it all out. Yeah.
Yes.
Yeah.
Well, they were saying our account's not paid, but we're trying to figure out how to, make sure. I said, well, we have to make sure that we pay it to something that was appropriately signed off on with the company that we have a contract with, that we have our business agreements and our I-9s, and, all of our W-9s, all these things in place. So I think, again, people just not always realizing the complexity of what's really involved.
Yeah.
Liaisoning with our payroll, in a big corporation, you're doing payroll, you're doing all the onboarding of staff, you're doing any helping with any evaluations, any wage adjustments, just so many things, just from an HR standpoint. Coming here, every other month or monthly for a week, trying to get as much done on site as you can. And then at home, trying to really make sure that we're focused in on the finances of what we have in and out as well. So, yeah.
It's challenging, but it's rewarding.
It is. And how have you been an effective remote worker? Like, I know, being a mom is a big part of your life. I said, it's a struggle for all of us, balancing our personal and our professional lives. What have you done to really make sure that you're able to be an effective remote worker?
I have to isolate myself. We often say I put myself in the corner.
So you can often find Nikki in the corner of her, or even Amari this morning when I had asked him if we want to be on it, he was like, I have to find somewhere quiet to go. The dogs could be loud and barking at any time.
Yeah, that's challenging too. Quiet can be challenging sometimes. Now that the kids are back in school, it's fine, but summers are a little challenging.
Definitely. Great. Well, thank you guys. Does anyone else have anything? There's so much we could say, I think, for sure. But I hope that as an audience out there, you're starting to get a feel for just what is really entailed. And again, it's 40 hours worth of podcast to really explain every member of our team and what each and every person does. I want you to know that you are appreciated. I want you to know that this is not about Dr. Amanda Ryan. I've always said that this is about a vision and a mission that is much larger than even me, that we are all making extensive personal sacrifices to make this work. And it really is for the patient. We are trying to do something different in an innovative manner, especially in rural areas. And we are really trying to develop this whole cardiovascular practice and service line in a manner that can be reciprocated or reproduced, at the next location as well. So, and as part of that, we hope to deliver care in a more cost-effective quality while maintaining quality and innovation, staying on top of the latest, greatest technology. And those things that, that sounds great for a mission, and that is our mission, which we do start our priorities meeting with talking about our mission so that we're reminded every week. Sometimes we have those Monday blues and 8 million things going on and people are calling in sick and we're making schedule adjustments. we try to remind ourselves, hey, this is the mission. This is the vision. You know, when I wake up not next to my husband on Monday morning and, you know, we're both running in 10 directions, you know, we try to remember why we're doing this. You know, what are we really trying to accomplish? So I just want to say thank you to you guys. Thanks for taking some time today. Let's finish out the week strong. And I look forward to talking to you guys later.
I want to thank my staff again for just the tremendous amount of focus and input that they really have on you, the patient's care. And I think, you know, what I want to talk about a future podcast, Tammy's going to talk about Medicare Advantage programs versus regular Medicare and some of the ins and outs of those options. I think that'll be great. Each of my staff have so much important, valuable information, knowledge to bring to the table and to really help assist you in your care. You know, I hope we've kind of started to lay the groundwork of how complex, you know, rural cardiovascular healthcare really is. Have a great week.